When I talk to a lot of my patients about surgery, a lot of them express the idea of, oh, I'm sagging or I'm drooping. So yes, there's a role of gravity in the facial aging process that people don't like and want to change. But what a lot of people miss is the idea of us losing volume over time as well. So the fullness that provides the beauty in your 20s and 30s, it goes away into your 40s and 50s and so on. Surgery by itself can help reposition things, but the best way to optimize that outcome as a complement to surgical repositioning of tissues is actually fat grafting. There are really two key areas where I find fat grafting particularly useful when it comes to facial rejuvenation. And that is first along the lower eyelid/cheek area, where we lose a lot of volume over time. And we tend to think that we have bags under the eyes, when in fact, what's going on in addition to the bags under the eyes is a little bit of hollowing of the cheek, especially towards the front and a little bit off to the side. And so when this is sunken, this looks more noticeable. That's why you want to help revolumize and rejuvenate the whole area with fat grafting. So that's the first area that I really like fat grafting. And the second area is right around here. When we think about the hinges of our body, this is where we move all the time when we speak, when we eat, etc. And so hinges are where we tend to thin out. And so fat loss occurs a little more quickly along here than along other areas of the face. And so along with the periorbital area, the perioral area around the mouth, those are the two areas where fat grafting for volumization and rejuvenation are very useful. In terms of what that means for the surgical plan, we obtain the fat from other parts of the body, and then we process it down, and we try to graft the fat in a relatively quick manner so that the time the fat is outside your body is minimized. Because the longer tissue is outside your body, the lower its chance of survival. And so what that means in terms of time is not a lot of time added to the surgery, actually. There might be a little bit of soreness around the donor sites for the fat in terms of obtaining the fat, but really there's not all that much additional pain. And so recovery is actually pretty decent. And when it comes to the overall viability of the fat, assuming your fat is of good quality and the technique is good, the take rates are really good because it's live tissue, and as soon as it incorporates the blood flow of the recipient sites of where we graft the fat in, there's a really high chance of a good outcome. So fat grafting, as wonderful as it is not without risk. There are two risks that immediately come to mind. The first risk is that you could be overgrafted with fat. So what that means is you look really puffy. And I tend to shy away from that just because in terms of recovery, it means longer downtime. And in all honesty, if you're overgrafted, it'll look unnatural in the end. And the whole point of what I do as a facial plastic surgeon is to help enhance your natural beauty. And so that's the first thing, which is overgrafting. And then the second concern is that your fat is subject to hormonal change. So what that means is if you're premenopausal, perimenopausal, if you have a major physiologic event like childbirth, there's a chance that the hormonal changes effect on the grafted fat can be in such a way that you may feel a little more swollen or a little more puffy for that period of time where your health and your physiology are changed. I think fat grafting is, you might say, even necessary in some cases of patients who want facial rejuvenation. And I've had patients who had lower eyelid bags say, oh, no fat, please. And I have acquiesced to that, and their outcomes have not been as great as they would have been if they had had fat grafting. And so when it comes to lower eyelid surgery, if you don't volumize the lower eyelid/cheek area, for some people whose cheeks are already sunken or set back, it's going to just look more hollow, and so you'll look older sooner. Part of looking youthful, yes, is having nice, youthful contours, not saggy skin, but at the same time, volume is such a big part of our youthful looks. And this applies especially to skinnier people who have skinny faces to begin with. And let's say your temples are hollowed out or your cheeks are not all that big. And when you perform a facelift, sometimes it accentuates those contours that make you look skinny. And again, it gives a less volumized look, which unfortunately can make you look not as youthful as you could have had you had fat grafting. For most people who have volume loss along with the saggy of the aging process, you don't need a ton of fat to be grafted to get the outcome that you want. I think in order to achieve a natural balance of a more youthful version of you using fat grafting along with surgery, you don't need a whole ton of fat. You maybe need like a tablespoon, so that's like half an ounce or 15 mLs. That's probably the most I would graft for most patients who have a normal amount of atrophy or volume loss associated with the aging process.